represent that one.
This is basically a sponsor's call, so this has to be
I was
fulfilled.
avoiding to say that.
No, it is perfectly all right. There is no this thing in it at all. So I will be, of course, I've been involved in the multicentric trial with for this product, Liffitegrast, which is 5%, which is very soon coming to the Indian market. And dry eye disease, I think we all know, is much more prevalent than what we used to think. Close to 50% of the patients have dry eye, and there is an ocular surface immune response also for this. Liffitegrast has got high aqueous solubility, is well tolerated, has short half-life with high clearance rate and low systemic exposure, is isotonic with human tears. It has a unique mechanism of action, and rapid absorption into the ocular tissues is also there apart from this, and it also gets rapidly eliminated from the system. So it alleviates both the signs and the symptoms of dry eye disease, which allows good therapeutic efficacy as ophthalmic drops and protects the corneal surfaces, and is also well tolerated locally as well as systemically. So basically what it does is that it binds the Liffitegrast 1 binds on the leukocytes and blocks their binding to ICAM1 in the adhesion, extravasation, migration, activation, cytokine secretion, and proliferation of these leukocytes in the inflammatory cells. And formation of this synapse of Liffitegrast with ICAM1 binding facilitates the T cell proliferation, cytokine release, and recruitment of more T cells at the inflammatory sites. And that is what Liffitegrast is trying to act on. It targets the LFA ICAM complex, and it suppresses the inflammation by mimicking ICAM1, and by blocking the interaction between Liffitegrast and ICAM1, it is able, LFA1 and ICAM1, it is able to disrupt the various key steps which are there in T cell mediated inflammation, which is responsible for the dryness. So basically, inhibition of T cell activation, cytokine release, formation of immunological synapse, and decrease of ocular inflammatory cycle does occur. And it is being used extensively in the other countries in our continent, but not in India, but will be available in India shortly. These are just in vitro assays which have proved that it inhibits the release of cytokines, interferon, etc. And again, this is to show the same pictographically, and there are various studies which have shown that it does normalize the various parameters, and these are the published studies on literature which have shown that there would be less amount of staining which will be there, the ocular surface disease index would improve, and the symptoms would improve, and the eye dryness score also would improve. OPUS trials have been done, and these are randomized double-blind placebo-controlled phase 3 studies where topical Liffitegrast 5% of placebo BD was used, and there were 3 periods, that is screening, treatment, and follow-up. And the eligible participants, they were included were more than 18 years and who had who actually had dry eye. In combination with the earlier studies and trials, OPUS trials, clinical trials have clearly shown that Liffitegrast does decrease corneal epitheliopathy and holds promise as a novel integrant antagonist for treatment of both signs and symptoms of dry eye disease, and warrants additional investigation. So this was the randomized control trial, which is multicentric, done across all centers, 4 centers across India, and these were the primary efficacy endpoint: the eye dryness score, ocular discomfort score, OSDI, and tear film breakup time. And the secondary efficacy endpoints were Sharma tear test, corneal fluorescein staining score, and subject rated global improvement score. And total of 370 patients were enrolled and were randomized, and this was conducted across 10 centers across India. So the results have been quite good in terms of age, height, weight, gender, etc. there was no difference. But if you look at the eye dryness score, there is a trend of decrease in the eye dryness score in the group where Liffitegrast was given, and this change was statistically significant in those cases where this was given, as opposed to those where it was not given. And same thing for ocular discomfort score as well, and likewise for the ocular surface disease index score as well as the tear film breakup time. Now, even the Sharma tear test, the fluorescein staining score and the conjunctival redness score showed that all the parameters were significantly improved with the use of the Liffitegrast. And the percentage of changes were higher as far as for all of these when you box plot for Liffitegrast group as compared to the CMC group, which was group B. As far as the adverse events were there, they were reported in both the groups. 3% reported in the Liffitegrast group and 5% in the CMC group. All of them were mild to moderate, and they resolved without any sequel and did not require any stoppage of the study medication as such. So to summarize, Liffitegrast group significantly is better than the CMC group alone for all parameters of eye dryness score, ocular discomfort score, OSDI, tear breakup time, Sharma test score, and the corneal fluorescein staining score. There is improvement in the subject rated global improvement as well as the investigator related global improvement. And I think it is a promising drug and will be available in India very soon. So this is the study or the systemic review and meta-analysis, which also concludes likewise the latest, which has been published just a few months ago. So thank you very much for your kind attention.
Thank you, ma'am.
Thank you, ma'am. Any questions from the audience? Okay, so with this, we come to the conclusion of this session. And thank you. Last AIOC annual, when we were doing a IC with Bhupesh, only the speakers were present. This time, at least 30-40 crowd is there, so we are quite happy with that. Thank you, all of you.
And thank you to Dr. Namrata, ma'am, for including our course in the...
No, thank you.
Please take a
Praful.
photograph.
I would particularly like to thank Praful because Praful has really worked hard with me on the scientific program.
Yes.
And thank you, Praful, for all your help. I don't know if Anu Malik is there or not. Even she's worked a lot. Thank you.
So they will take...
I barged